Hi, my name is David Chen with Christianicare Health System and our partners here, and I will be presenting work done by our group on community engaged latent class analysis. Community violence exposures, generally understood as witnessing or victimization by public acts of violence, have been studied the most in children and adolescents, but much less in adults. The focus of study has been primarily in relation to impact on mental health, community level influences, or acts of terrorism and war, but little has related to general medical health. Some studies have suggested a negative impact of these exposures on medical conditions not typically associated with trauma, such as asthma, but this interaction is difficult to describe beyond the general strain placed on communities and individuals. To explore the relationship between community violence exposures and health, we began with data gathered from a large community survey in the city of Wilmington, Delaware in 2017. This survey was collected by members of the community who were trained as participatory action researchers through methods developed by Dr. Yasser Payne's group at the University of Delaware. To explore the relationship between these variables, we use latent class analysis, which is a statistical model that uses categorical observations, such as patterns of responses in survey data, to sort individuals into mutually exclusive groups or classes. To use analogies, it would function like the sorting hat from Harry Potter that classifies each student into different dormitories based on different qualitative features, or like an online quiz predicting which political party you might identify with based on answers to various questions. In this model, we selected variables that we thought might be the best indicators and covariates describing a person's health sensitivity to community violence exposures. Using this statistical method, 4 distinct classes were identified. In discussion with participatory action researchers, the following descriptions and names were assigned to the classes: witnesses who are men, witnesses who are women, victims, and bystanders. Each of these 4 images describes a different class or group, where the red circles indicate how members of that group answered a question compared to the entire community as a whole. For example, those in the victim group, the upper right corner, were much more likely to have been injured by multiple forms of violence and to have witnessed it. We then looked at associations between these groups and health. Overall, there was no significant difference in describing their own health, which was fairly positive. As an example, those who were in the victim group did not have greater expectations for future worsening health than other groups. Yet there were differences in the chronic health conditions between these groups, where notably the group described as women who were witnesses to violence were nearly as likely to have chronic health conditions as the group described as victims. Why is this? The second part of our study is in progress to explore these relationships and patterns with focus groups from the same communities the original survey assessed. Future research can help identify whether community violence exposures have a greater impact on certain health conditions than others, and explore ways this impact can be prevented or treatment of existing medical conditions can be more effective.